Welcome to the July Wellness Webinar. I'm Laura Maloof-Miller. I'm a Wellness Program Manager with HealthNet. Kristen Kayla, as you know, Health Promotion Consultant with HealthNet, is also on the line to assist me today. Just a couple of housekeeping items to review before we begin. Everybody's been muted upon entering the webinar, and that's to avoid any background noise. And if you want to change your audio settings, all you do is click on the Join Audio icon. Also, at the end of this webinar, there will be a 4-question anonymous survey. All right, if you are having any technical difficulties, feel free to chat directly to Kristen. So all you need to do is open the chat box, hover over the Zoom toolbar at the top of the screen. You will see a chat box icon there. Simply click on that icon and it should appear. Now, Kristen will receive your messages in real time and she'll respond to your message in order that she receives them. So if you're attending this webinar in a conference room, or if you used a single webinar access with your team, please chat that number of attendees to Kristen so that we can get a more accurate number on attendance. The information provided in this presentation is intended solely for the general information of the audience. It's not medical advice and shall not replace consultation with your physician or other qualified health provider. If you have any health-related questions or problems, please seek the advice of your physician or other qualified health provider. Today's topic: your brain matters. Now, we know the brain is one of the largest and most complex organs in the human body. It's made up of more than 100 billion nerves that communicate in trillions of connections called synapses. Now, these are the areas I'm going to be covering today. What makes up the central nervous system and its function? Types of brain injuries, from concussions to traumatic brain injuries. How can we best protect our brain from injury? We'll look at some common brain conditions such as Alzheimer's and others. And lastly, I'll review some ways to keep your brain healthy and engaged. Let's start with a true or false. We use 10% of our brain. So let me launch this poll. All right. We use 10% of our brain. Is that true or false? Responses are coming in. Well, it's pretty close, neck and neck right now. All right, couple more seconds. All right, gonna go in the poll and share the results. All right, can you see that? We have 56 people, 56% coming in with true and 44 coming in with false. The answer is actually false. Evolutionarily, it would make no sense to carry around surplus brain tissue. And if the 10% idea were true, it sure would make brain damage a lot less worrisome. Now, medical scans show that much of our brain is engaged even during simple tasks. An injury to small sections of the brain can have profound consequences for language, movement, emotion, or sensory perception. So what is the central nervous system? Well, it consists of the brain and the spinal cord. Now, the brain is an important organ that controls thought, memory, emotion, touch, motor skills, vision, breathing, temperature, hunger, and every process that regulates our body. The brain can be divided into the cerebrum, brainstem, and cerebellum. The cerebrum is composed of the right and left hemispheres, which are joined by the corpus callosum. Now, functions of the cerebrum include initiation of movement, coordination of movement, temperature, touch, vision, hearing, judgment, reasoning, problem solving, emotions, and learning. Now, the brainstem, which includes the midbrain, includes the midbrain, the pons, and the medulla. The functions in this area include movement of the eyes and mouth, relaying sensory messages such as hot, pain, or loud, respiration, consciousness, cardiac function, involuntary muscle movements, sneezing, coughing, vomiting, and swallowing. The cerebellum is located at the back of the head, and its function is to coordinate voluntary muscle movements and to maintain posture, balance, and equilibrium. Now, more specifically, other parts of the brain include the frontal lobe, where this is the largest section of the brain located in the front of the head. The frontal lobe is involved with personality characteristics and movement. Recognition of smell usually involves part of the frontal lobe as well. The parietal lobe, which is the middle part of the brain, this helps a person identify objects and understand spatial relationships, where one's body is compared to objects around the person. The parietal lobe is also involved in interpreting pain and touch in the body. The occipital lobe is the back part of the brain, and that's involved with vision. The temporal lobe, both sides of the brain, the temporal lobes are involved in short-term memory, speech, musical rhythm, and some degree of smell recognition. The brain stem includes the pons, which is a deep part of the brain. Now, the pons contains many of the control areas for eye and face movements. The lowest part of the brain stem, the medulla, is the most vital part of the entire brain and contains important control centers for heart and lungs. Now, the spinal cord is a large bundle of nerve fibers located at the back, and that extends from the base of the brain to the lower back. The spinal cord carries the messages to and from the brain and the rest of the body. Now, your brain determines every aspect of your life, and without your brain, there is no self, no awareness of the world. Your brain is a 3-pound universe that processes 70,000 thoughts each day using 100 billion neurons that connect at more than 500 trillion points throughout synapses that travel at 300 miles an hour. The signals that travel through these interconnected neurons form the basis of memories, thoughts, and feelings. True or false? The brain stops developing in adulthood. To the next one. Launch that. All right, true or false? The brain stops developing in adulthood. Responses are coming in. And these are optional. Of course, you don't have to participate if you don't want to. That I would just share that. All right, responses have pretty much come to a stop here. I'm going to end the poll and share those results. All right, 83% of you got it correctly. That is true. Even in adulthood, the brain is continuously remodeling itself. Now, the formation of neurons, those are the basic brain cells that communicate with each other through electrical signals, that begins very early in the human embryo. By 5 weeks after conception, cells in the developing brain begin dividing rapidly to form the 100 billion or so neurons that an infant's brain has at birth. At birth, the infant brain weighs from 2/3 to 3/4 of a pound. The connections in the parts of the brain that control basic survival and reflexes, they are already well developed. In early childhood years are a period of rapid change in the brain. During this time, the brain forms and refines a complex network of connections. In the first 4 years of life, the brain increases to about 80% of its adult weight. The brain continues to change and mature throughout adolescence. An adolescent brain reaches its adult weight at about the age of 14. Adolescents become more capable of insight, judgment, inhibition, reasoning, and social conscious. Increased activity in the frontal lobe enables the adolescent to begin analyzing and interrelating several concepts at once. The brain continues to develop connections throughout adulthood, but with two major differences. The rate of synapses formation is much slower than in childhood, and the synapses are formed based only on specific experiences in the adult's life. Now, lifelong activity is important to maintain healthy brain growth. Areas of the brain that are not used regularly may eventually atrophy. Activity can be as simple as reading, working a crossword puzzle, or spending time talking to others and maintaining relationships. A person who isolates himself stops having experiences that keep the brain active. That's why social connection is so important. Let's talk about some different types of brain injuries. True or false? Brain damage is always permanent. Here we go, launching that. True or false? Brain damage is always permanent. What do you think? Couple more seconds on that. All right. You are correct. 82% of you said that is false, and that is correct. A person's ability to recover from brain damage really depends on the severity and location of the injury. For example, a blow to the head during a football game might lead to a concussion. While the injury could be quite serious, most people can recover when given enough time to heal. A severe stroke, on the other hand, can result in damage that could very well be permanent. However, it's important to remember that the human brain has an impressive amount of plasticity. So even following a serious brain event, such as a stroke, it is possible for the brain to partially or fully heal itself over time and form new connections. Now, there are two major types of brain injuries. The first one is traumatic brain injuries, or TBI. Now, the severity of a traumatic brain injury is typically determined by the Glasgow Coma Scale. The scale uses this table to categorize injuries as mild, moderate, or severe. Now, the lower the number on the scale, the duration of loss of consciousness and the duration of post-traumatic amnesia determine the severity of the brain injury. Now, mild traumatic brain injuries are caused by a blow to the head or violent shaking that can cause temporary brain damage and impairment of cognitive ability. Now, most people who experience a mild TBI, though, can't expect a full recovery. A mild TBI is categorized by a score ranging from 13 to 15 on the scale. Many mild TBI injuries can be defined as concussions, and consciousness is rarely lost for more than 30 seconds for a mild traumatic brain injury. Now, despite the mild label, they can have significant impacts on cognition and behavior, and recovery may vary from person to person. Some of the symptoms include fatigue, headaches, light sensitivity, dizziness and balance problems, irritability, depression and mood swings, nausea, general confusion, and mental fog. Now, a moderate brain injury will score between 9 and 12 on the scale. Consciousness is often lost for a significant amount of time, ranging from several minutes to several hours, and post-injury recovery may last for months. In certain cases of a moderate TBI, full recovery may not be a possibility. Typically, a person with a moderate traumatic brain injury who regains consciousness will have symptoms like those of a person with a mild TBI, but the symptoms will be much more severe. Symptoms may also persist for a significantly longer duration, or they might be permanent. So things like strong recurring headaches, amnesia, which is memory loss, fluids draining from the ears or nose, dilation of the pupils, seizures, slurring of speech. A severe traumatic brain injury is typically characterized by comatosis or a coma, and often permanent brain damage. Now, death may occur in extreme circumstances. A severe TBI is any brain injury that results in a score of 8 or lower on the scale. A severe traumatic brain injuries can result from blunt trauma, but it also can be the result of penetration of the skull from an external object. Severe TBI symptoms include difficulty coordinating balance, blurred vision in one or both eyes, changes in sensory perception, trouble speaking and swallowing, lack of bowel and bladder control, motor impairment, difficulty forming sentences, confusion, difficulty with reasoning and logic. Traumatic brain injuries can occur from a wide range of accidents. Now, there are a few common causes of a traumatic brain injury, though, that are worth noting. According to the Centers for Disease Control, these causes include falls, right at 40%, being struck or by or against something, motor vehicle or traffic crashes, assaults and abuse, and 19% is actually unknown or other. Now, blasts are a leading cause of traumatic brain injuries for active duty military personnel in war zones. You can see the statistics here on how big this problem is. According to the Centers for Disease Control, there were over 64,000 traumatic brain injury related deaths in the US in 2020, just over 223,000 hospitalizations in 2019. We talk about the kids, birth to 17. They had close to 3,000 traumatic brain injury related deaths in 2020 and over 16,000 hospitalizations in 2019. Now, a concussion is a type of traumatic brain injury caused by a bump, blow, or a jolt to the head, or by a hit to the body that causes the head and the brain to move rapidly back and forth. This sudden movement can cause the brain to bounce around or twist in the skull, creating chemical changes in the brain and sometimes stretching and damaging brain cells. Medical providers may describe a concussion as mild, a mild brain injury, because concussions are usually not life-threatening. Even so, the effects of a concussion can be serious. It's interesting to note what signs are observed when someone seeks medical help for this, and compare that to what the actual person reports. So on the left side, what is observed is they can't recall events prior to or after the hit or the fall. Now, one time my sister was bucked off of her horse. She landed face down in the sand arena. She couldn't recall what had happened and was wondering why she was on the ground. Luckily she was wearing a helmet. They also appear dazed or stunned, moves clumsily, answers questions slowly. Maybe there's loss of consciousness, even briefly, and they show mood, behavior, or personality changes. On the right side this is what somebody would report or say who has had a concussion. They feel a headache or pressure in the head. There's nausea or vomiting, balance problems, dizziness, double vision or blurry vision, bothered by light and noise, confusion or concentration or memory problems, and that feeling of, oh, I don't feel right. I'm kind of feeling down. Now, a long time ago, I flew down a kiddie slide at the park. I went down so fast, I hit the back of my head on the end of the metal slide. Ouch. That took me a minute to get up, and I saw stars, which had resulted in a mild concussion. Now, the second type of brain injuries are called anoxic or hypoxic. So unlike traumatic brain injuries in which the brain damage is induced by direct physical trauma, anoxic and hypoxic brain injuries are brain injuries characterized by a lack of oxygen being provided to the brain. So anoxic brain injuries are caused by complete lack of oxygen being provided to the brain, which of course results in the death of the brain cells after approximately 4 minutes of oxygen deprivation. Now, hypoxic brain injuries are brain injuries that form due to a restriction on the oxygen being supplied to the brain. This restricted flow of oxygen causes the gradual death and impairment of brain cells. Now, these type of brain injuries, they may be caused by a stroke, but they can also be caused by cardiac arrest or cardiac arrhythmia. Sometimes it's due to the blood not being able to properly carry enough oxygen, or if there's not enough blood in the body itself to support the oxygen needs of the brain. It could be chemicals or poisons that hinder the ability of the brain to receive oxygen from blood cells, or a lack of oxygen in the air, resulting in suffocation. Now, these injuries often cause initial loss of consciousness, which can be short-term or long-term, depending on the severity and the length of the oxygen deprivation. Other symptoms of this type of injury may include slurring and difficulties with speech, confusion and disorientation, or facial drooping. Upon regaining consciousness, the effects and symptoms are often like that of a traumatic brain injury, depending on the severity of the injury. More severe brain injuries may actually leave the patient in a vegetative state. So, how are we going to use our head to keep our brain safe? Well, follow these tips to reduce the risk of brain injury. Always wear a seatbelt in a motor vehicle, and a small child should always sit in the back seat of the car secured in a child safety seat or a booster seat that is appropriate for their size and weight. Don't drive under the influence of alcohol or drugs, including prescription medications that may impair the ability to drive. Always wear a helmet when you're riding a bicycle, skateboard, motorcycle, snowmobile, or all-terrain vehicle. Also, wear appropriate head protection when you're playing baseball or other contact sports, skiing, skating, snowboarding, and riding a horse. Now, to avoid falls around the house, you want to install handrails in the bathrooms. Put a non-slip mat in the bathtub or the shower. Remove area rugs. Improve lighting in your home. Keep stairs and floors clear of clutter. Get regular vision checkups and regular exercise. Preventing head injuries in children include installing safety gates at the top of a stairway, installing window guards to prevent falls, and using playgrounds that have shock-absorbing materials on the ground. And young children should not play on fire escapes or balconies. What are some common conditions that affect the brain? Now, each of these common brain conditions could be its own webinar. However, I'm going to touch on the highlights of each. First up is Alzheimer's. So the terms dementia and Alzheimer's can be confusing. Now, many people believe they are synonymous, but the two words actually mean different things. Dementia is a general term for a decline in mental ability severe enough to interfere with daily life. Now, Alzheimer's is the most common cause of dementia. So Alzheimer's is a specific disease. Dementia is not. Now, there are many types of dementia and many conditions cause it. Alzheimer's disease accounts for 60 to 80% of the dementia cases. Alzheimer's is a degenerative brain disease that is caused by complex brain changes following cell damage. The most common and early symptom of Alzheimer's is trouble remembering new information, because the disease typically impacts the part of the brain associated with learning first. As Alzheimer's advances, symptoms get more severe and include disorientation, confusion, and behavior changes. Eventually, speaking, swallowing, and walking become difficult. Now, there's no way to prevent it, cure it, or even slow Alzheimer's disease, though the greatest known risk factor for Alzheimer's is increasing age. Most people with Alzheimer's are 65 years and older. However, approximately 200,000 Americans under age 65 have younger onset Alzheimer's disease. So these are some early signs and symptoms. Now, these are warning signs. So if you notice any of them, don't ignore them. Schedule an appointment with your doctor. One of the most common signs of Alzheimer's disease, especially in the early stage, is forgetting recently learned information. Others include forgetting important dates or events, or asking the same questions over and over, and increasingly needing to rely on memory aids, such as reminder notes or your electronic device, or family members for things you used to be able to handle on your own. Now, before you all start thinking, oh my gosh, I've got Alzheimer's, let me tell you what a typical age-related change is. Sometimes forgetting names or appointments, but remembering them later. Some people with Alzheimer's may experience changes in their ability to develop and follow a plan or work with numbers. They may have trouble following a familiar recipe or keeping track of monthly bills. But what is typical age-related change? Making occasional errors when managing your finances or your household bills. People with Alzheimer's often have a hard time completing daily tasks. Sometimes they may have trouble driving to a familiar location, organizing a grocery list, or remembering the rules of a favorite game. What's typical age-related change would be occasionally needing help to use the microwave settings or to record a TV show. People living with Alzheimer's often lose track of dates, seasons, and the passage of time. They may have trouble understanding something if it's not happening immediately. And sometimes they may forget where they are or how they got there. Okay, that happens to me. What is typical is getting confused about the day of the week, but figuring it out later. For some people, vision problems is a sign of Alzheimer's. This may lead to difficulty with balance or trouble reading. They may also have problems judging distance and determining color or contrast, which can cause issues when driving. But again, typical age-related change would be vision changes related to cataracts. And folks also living with Alzheimer's may have trouble joining a conversation. They may stop in the middle of a conversation and have no idea where to continue, or they actually may repeat themselves. Okay, again, what's typical age-related change would be sometimes having trouble finding the right word. Okay, that happens to me all the time. A person living with Alzheimer's may also put things in unusual places. They may lose things and be unable to go back over their steps to find them again. They may accuse others of stealing, especially as the disease progresses. Okay, replacing things, misplacing things, it's a typical age-related change. It's okay to misplace things from time to time. It's just that you have the ability to then retrack your steps to find them. Now, individuals may experience changes in judgment or decision-making. For example, may use poor judgment when dealing with money, or pay less attention to grooming or keeping themselves clean. Typical age-related change would be making a bad decision or making a mistake occasionally, things like neglecting to change the oil in the car. A person with Alzheimer's may experience changes in the ability to hold or follow a conversation. As a result, they may withdraw from hobbies, social activities, or other engagements. Typical age-related change is sometimes feeling uninterested in family or social obligations. Okay, that's normal. Individuals living with Alzheimer's may experience mood or personality changes. They may become confused, suspicious, depressed, fearful, or anxious. They may become easily upset at home with friends or out of their comfort zone. Again, what's typical? Developing very specific ways of doing things and become irritable when that routine is disrupted. That is a normal. All right. A little bit about epilepsy. Now, we talked earlier about how our brain is comprised of billions of neurons, nerve cells that process and transmit information by interacting with each other. Now, most neuron interactions occur with few disruptions. Occasionally, small neurons misfire, which may occur with very little consequences. Yes, sometimes multiple cells misfire at the same time. Now, this is a seizure, a sudden disorganized electrical discharge in the brain causing muscle twitches and spasms, changes in sensation, mood, behavior, or altered consciousness. Epilepsy can affect people in different ways, and this is because there are very many causes and many different kinds of seizures. Some people may have multiple types of seizures or other medical conditions in addition to epilepsy. Now, these factors play a major role in determining both the severity of the person's condition and its impact it has on their life. Now, the way a seizure looks is going to depend on the type of seizure a person is experiencing. Some seizures look like staring spells. Other seizures can cause a person to collapse, shake, and become unaware of what's going on around them. Epilepsy can be caused by different conditions that affect a person's brain. Unfortunately, many times the cause is unknown. Some causes, though, do include stroke, brain tumor, a traumatic brain injury or head injury, or a central nervous system infection. Parkinson's disease is a progressive nervous system disorder that affects movement. Symptoms start gradually, sometimes starting with a barely noticeable tremor in just one hand. Tremors are common, but this disorder also commonly causes stiffness or slowing of movement. In the early stages of Parkinson's disease, the face may show little or no expression. The arms may not swing when walking. Speech may become soft or slurred. Now, Parkinson's disease worsens as the condition progresses over time and may include muscle stiffness that may occur in any part of the body. The stiff muscles can be painful and limit the range of motion. Posture may become stooped, or balance problems may occur as a result of Parkinson's disease. Now, although Parkinson's disease can't be cured, medications might significantly improve symptoms. Occasionally, doctors may suggest surgery to regulate certain regions of the brain and improve symptoms. Now, see your doctor if you have any of the symptoms associated with Parkinson's disease, not only to diagnose your condition, but also to rule out other causes for your symptoms. Mental disorders or mental illnesses are conditions that affect your thinking, feeling, mood, and behavior. They may be occasional or long-lasting, and they can affect your ability to relate to others and function each day. Now, there are many different types of mental disorders. These are some of the common ones. So anxiety disorders that would include panic disorder, obsessive compulsive disorder, and phobias, depression, bipolar and other mood disorders, eating disorders, personality disorders, post-traumatic stress disorder, and psychotic disorders, which would include schizophrenia. Now, several factors can contribute to the risk for mental illness, such as your genes or your family history, your life experiences, such as stress or a history of abuse, especially if they happen in childhood. Biological factors, such as chemical imbalances in the brain, a traumatic brain injury, a mother's exposure to viruses or toxic chemicals while pregnant, the use of alcohol or recreational drugs, having a serious medical condition like cancer, or having few friends and feeling lonely or isolated. Mental disorders are common. More than half of all Americans will be diagnosed with a mental disorder at some time in their life. Now, treatment depends on which mental disorder you have and how serious it is. You and your provider will work on a treatment plan that's just for you. It usually involves some type of therapy. You may also take medications, and some people also need social support and education on managing their condition. A stroke. Now, this can be caused either by a clot that's obstructing the flow of blood to the brain. This is called an ischemic stroke, or by a blood vessel rupturing and preventing blood flow to the brain. This is called a hemorrhagic stroke. Now, a TIA, or transient ischemic stroke or attack, is a mini stroke, and that's caused by a temporary clot. The brain is an extremely complex organ that controls various body functions. If a stroke occurs and the blood flow can't reach the region that controls a particular body function, that part of the body won't work as it should. You may notice on the slide, depending on what side of the brain the stroke occurs, the opposite side of the body is affected. The American Stroke Association uses this acronym to get help fast if you suspect someone is having a stroke. Now, time to medication, which may bust up the clot, is critical. Usually it's about within 3 hours after the first appearance of a stroke. That's all you've got. If it's too late, the medication cannot help and symptoms of a stroke may be permanent. So, F for face drooping. Does one side of the face droop or is it numb? Ask the person to smile. Is the person's smile uneven or lopsided? Arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift downward? Speech. Is speech slurred? Is the person unable to speak or hard to understand? Ask the person to repeat a simple sentence. T, time to call 911. If the person shows any of these symptoms, even if the symptoms go away, call 911 and get them to the hospital immediately. Now, if you join me for the February webinar on heart health, you may remember there were some modifiable risk factors for heart disease. Turns out many of the same ones apply to brain health as well. And they include high blood pressure, depression, brain injuries, especially those due to falls or accidents, some medications or improper use of medications, lack of physical activity, poor diet, smoking, drinking too much alcohol, sleep problems, social isolation, and loneliness. All of these can have a negative effect on the brain. So, how are we going to keep our brain healthy and engaged? True or false? A crossword puzzle a day can keep the brain doctor away. Let me launch this one. Stop sharing that one. All right. True or false? A crossword puzzle a day can keep the brain doctor away. What do you think? True or false? Couple more seconds on that. All right, here are the results. We had 87% said true. Well, that's false. The 13%, you got it right. A crossword puzzle does flex parts of your brain related to word finding ability, but it's not a cure-all. While that might help you excel at a skill, it's important to challenge your brain in a variety of ways. Now, growing evidence indicates that people can reduce their risk of cognitive decline by adopting some key lifestyle habits. Start now. It's never too late or too early to incorporate healthy habits. Formal education in any stage of life will help reduce your risk of cognitive decline and dementia. Take a class at a local college or community center or online. Challenge and activate your mind. Build a piece of furniture. Complete a jigsaw puzzle. Do something artistic. Play games, especially ones that make you think strategically. Stay socially engaged. That may help support brain health. Pursue social activities that are meaningful to you. Find ways to be part of your local community. Consider volunteering at a local animal shelter. If you enjoy singing, join a local choir or an after-school program, or just share activities with family and friends. It's actually probably better for brain health to have a conversation over lunch with a friend than to memorize numbers in reverse. Take care of your mental health. Some studies link a history of depression with increased cognitive decline. So seek medical treatment if you have symptoms of depression, anxiety, or other mental health concerns. Now, not getting enough sleep due to conditions like insomnia or sleep apnea may result in problems with memory and thinking. Get enough sleep and get help for existing sleep problems. Evidence shows that smoking increases the risk of cognitive decline. Quitting smoking can reduce that risk to levels comparable to those who have never smoked. Also, risk factors for cardiovascular disease and stroke, like obesity, high blood pressure, and diabetes, those negatively impact your cognitive health. Take care of your heart, and your brain may just follow. Engage in regular cardiovascular exercise that elevates your heart rate and increases the blood flow to the brain and body. Now, although researchers aren't clear how this works, the benefit may be related to increased blood flow to the brain, which strengthens connections between the memory-forming cells. Or it may be that exercise triggers the release of certain brain chemicals, including growth factors, that are also important in stimulating these connections. Eat a healthy and balanced diet that's lower in fat and higher in veggies and fruit to help reduce the risk of cognitive decline. Although research on diet and cognitive function is limited, certain diets, including the Mediterranean diet, may contribute to risk reduction. Stress and its associated hormone cortisol can, over time, cause an inflammatory response that leads to the formation of free radicals that may damage normal brain functions. Develop tools to get through stressful moments like breathing exercises, journaling, or yoga. Do you own a Labradoodle, a French Bulldog, or good old mutt? No matter what the breed, at the end of your leash stands your very own furry, wet-nosed brain health wellness coach. Sure, you already know that your pup provides unconditional love, warm snuggles, and good reasons to get off the couch. But did you know that science too supports the notion that dogs and cats too are good for your overall health and well-being, including brain health? Now, walking dogs or taking them to the park gets us moving. And regular exercise helps decrease blood pressure and cholesterol levels and increases oxygen and blood flow to the brain. Simply petting a dog or a cat can lower your blood pressure, heart rate, and increase levels of serotonin and dopamine. Those are the happy brain chemicals that release feelings of pleasure and calm. Having a dog has been shown to reduce depression. Walking with a dog or taking your dog to a park can lead to more social connection with others. People with more social relationships tend to live longer and are less likely to show mental and physical decline as they age. If you're forgetful, it could be due to lack of sleep or a number of other reasons, including genetics or level of physical activity or lifestyle, environmental factors. However, there's no doubt that a diet also plays a role in brain health. The best menu for supporting memory and brain function encourages good blood flow to the brain, much like what you'd eat to nourish and protect your heart. Getting adequate vegetables, including broccoli, cabbage, and other dark green leafy greens, may help improve memory. Try a kale salad or substitute collard greens for a tortilla in your next sandwich wrap. Broccoli stir fry is also an excellent option for lunch or dinner. Berries, especially the dark ones like blackberries and blueberries, as well as cherries, may support memory function. Enjoy a handful of berries or pitted cherries for a snack. Mix it into your cereal. You can reap these benefits from fresh, frozen, or dried berries and cherries. Just watch the portion size. Now, essential for good brain health is omega-3 fatty acids. They may help improve memory as well. You can find these in seafood, algae, and fatty fish, things like salmon, bluefin tuna, sardines, herring. You can also substitute a fish once or twice a week to get a healthy dose. If you don't like fish, talk with your doctor or other registered dietitian about possibly some supplements. Now, well known for their positive impact on health, walnuts may also improve cognitive function. Snack on a handful of walnuts to satisfy midday hunger, or add them to oatmeal or a salad for crunch. Again, watch the portion size. Now, while there's no guarantee that these foods are going to help you remember where you put your keys tomorrow, overall, they can help support a lifelong good health. Better memory, improved focus, lower odds of developing dementia. Brain health is big business. In 2019, a report by the Global Council on Brain Health projected by next year, 2023, people will spend more than $5 billion a year globally on brain health supplements. But can popping a pill really boost your brain power? The research in this area is in its infancy. Now, this is according to dietitian Maxine Smith from the Cleveland Clinic. She says we don't yet have the data we need to make a recommendation about whether brain supplements work, and there are some safety concerns. Supplements are loosely regulated by the United States, so there's no guarantee that they'll do what they claim to do. And the studies done by the manufacturers aren't always well designed, she said, and some supplements might contain ingredients at doses that could be harmful. So it's always best to discuss supplements with your physician before taking. Now, these next slides are on programs that help our HealthNet members stay on track with their health. Our members can find wellness programs and other resources when logging into your HealthNet account. Our health risk assessment is called the Real Age Assessment. Be sure to take it and check out our Wellness Center programs. Now, MyStrength has proven tools for mind, body, and spirit. This online program is available in an app form to access through your smartphone, so you'll have support at home and on the go. It helps you with stress, anxiety, depression, substance abuse. It has videos from mental health professionals, guided meditations, and inspirations on the topics of joy, laughter, positivity, meditation, mindfulness, and much more. Telephonic support at your fingertips. Tackling a new health goal can be challenging, but you don't have to face it alone. Maybe you'd like to explore health coaching. Coaches can help you prioritize your goals, strategize a plan, support you through your journey, and help you tackle those bumps in the road. Now, if you have a health concern, our HealthNet members can call a nurse advice line to speak to a registered nurse. Don't forget about our discounts. HealthNet members, you can receive discounts on Weight Watchers, chiropractic and acupuncture services, eye care, hearing aids, and even our fitness club discount. If you're not a HealthNet member, check with your health plan to see if they offer similar programs. HealthNet and non-HealthNet members can use Find Help. This is a social services resource and referral platform. It's a nationwide database of free and reduced cost direct services. Simply go to the link that's shown here, take the social needs self-assessment to assess your current needs. You simply need to just enter your zip code and you'll find a list of local, free, and reduced cost services, such as housing, food, education, and much more. Now, we offer a variety of online health challenges. The one where you can always join, the ongoing one, is the monthly challenges are stress, sleep, and steps. That's open to everyone. For HealthNet members, we've got Step It Up. That's going to be the health challenge for August. So you step it up by increasing your steps during the month, aiming to walk 5,000 steps per day for at least 21 days out of the month. Last but not least, please mark your calendar to join us for our next wellness webinar in August called Positive Thinking, a New Attitude. In this webinar, we'll be talking about traits and characteristics associated with a positive mindset, how to shift from negative thoughts to positive ones, simple ways to be positive in your daily life and at work, the positive effect an optimistic attitude has on our lifespan, and practical tips for looking on the bright side. I hope you'll join me for that. Thank you so much for your time today. Please remember, if you attended this webinar in a conference room or used a single webinar access with your team, please chat that number of attendees to Kristen. And everyone who registered for this webinar will receive a link to the recording in just a few days. Thank you so much for your time. You may exit the webinar.